I think we're to the final question in this group, which is, why does it matter? What does seamless real-time spatial computing mean for surgeons in the OR? How does it cut down on non-value tasks that keep them from focusing on operating? What doors does it open for the next generation of robotic systems? Why does it matter? Why does it matter? Well, at this company, we believe that healthcare is challenging, right? And we believe in surgeons, and we believe in medicine, and we believe in technology as a solution to help surgeons and to benefit medicine. And when we think about the embodiments of technology today, we think it's really great that there's this combination of surgeon and technology that takes the best of both worlds, which is, hey, look, the caring, the decision making, the knowledge, the domain experience that a surgeon carries to treat patients, and then the measurement tools that happen in computers and the very rapid calculations and the accuracy that you can achieve. The challenge that we face, and why does it matter for us, is that the surgical experience matters, and surgical experience matters for the patient, absolutely, but it also matters for the surgeon, and the surgeon is having to do more procedures than ever. And we think about, hey, look, part of the things you're doing in cases right now are in service of the technology. So in order to extract the information and the data and to have the tools work for you, you have to give to them. And we actually don't think that that's how this should work, right? The tools should give to you. And so what I mean by that, well, when you drill a pinhole into the patient, first of all, drilling extra holes in patients, probably not so great, not a great experience for the patient, probably not a great experience for the surgeon, and extra steps that happen in the procedure. But then you have to program where the things are. Again, more time, more steps, more hassle, right? And so when we think about 3D solutions and spatial computing, we say, hey, look, the procedure could be as simple as make your arthrotomy, the camera looks at the knee, and you're ready to go. And decisions are brought to you, and you make decisions about the procedure, and you carry out your procedure, and it's kind of seamless, right? And so why do we think that this is important? We think that, hey, with the burden on healthcare, with the burden on surgeons, with the volume of patients coming, it's on us to do better, and we think that there is a better, less invasive, faster way of using technology to get really good outcomes. And I think part of the challenge is surgeons have really pushed the edge, right, of surgery, right? We're looking at new ways of treating patients. We're paying attention to PROM scores and how do patients do after, and what is their experience. PROMs is really about patient-reported outcome measures, right? How does the patient feel about the procedure? And there's a lot of efforts in alternative alignments and soft tissue balancing to do better, but are the tools there to help you keep up and to make meaningful decisions? And so why does this matter? It matters because there's lots of procedures, there's lots of surgeons, there's lots of surgical time to save, and there's some efficiency to be driven. And most importantly, the technology should help the surgeon. The surgeon should not be in service of the technology.